Dr. Hogan actually attended medical school right here in DC at Howard University College of Medicine, followed by attending his orthopedic residency not too far from here at UVA. We actually completed a research track. This was funded by the NIH, but he also had a clinician scientist grant from the OREF for this. He went on to HSS to complete his foot and ankle fellowship and was recruited by Dr. Freddie Fu at Pitt to join the faculty there. So once he got there, he really climbed through the ranks. He was the division chief of foot and ankle, as well as the program director of the orthopedic residency. And he also was the chair of one of the hospitals through UPMC, the department chair of orthopedic surgery. We recruited some of our fellows from where I was at before. He is the true triple threat. He's an excellent clinician. He's an excellent researcher with more than 200 peer-reviewed publications and book chapters, and also an excellent educator. So he has also been on the board of the Foot and Ankle Society, as well as recently being the natural successor to Freddie Fu, where he became the chair of the orthopedic department there. And he recently was able to obtain a $25 million philanthropy gift to actually help their research enterprise there. So I've known Mac for more than 20 years. We actually met as a medical students at a research symposium in Miami. And we also actually presented together in 2008 when UVA was hosting the OREF Resident Symposium at their campus. So it's really my honor to introduce one of our pioneers in orthopedics here, Dr. Hogan.
So he essentially gave my talk on my journey, and so now we get to make up some things as we go. But no, I do have a few thanks to Disu. It's just really an honor and privilege to be here, and I have a few things, a few of the highlights he mentioned. I'll add some pictures, but they're not from Miami South Beach, where Disu and I did first meet. So when they asked me about the topic, I'm going to move around a little bit here with the topic, but it's really, one, it was just an honor to be asked by Dr. Khanna, by Jay and Adisu to come speak, and the collaboration we've had with Lee and the OREF, and really how it has been a huge impact on my life and my career. And when doing this, I was very specific to say, this is a surgeon scientist journey. This is my journey. Everybody's just different and unique. And I consider myself fortunate and blessed in just the places I've been and with the people I've been with it. And we'll talk a little bit on that. So it's not a lot of science in this, but it'll be a little bit. So as mentioned, I'm at Pitt. We now have the Bethel Musculoskeletal Research Center. And all of these things really take a team. And I will speak a little bit about our research center, which was launched really through the blood, sweat, and tears and spine surgery. So I can't hate on the spine surgeons too much, by one of our extraordinary researchers and surgeon scientists, Dr. June Lee. And I have no conflicts with this particular talk. I have to give respect to Dr. Fu. I would not be in this position. And he was, as a number of us who are here who knew of him, he was one of those individuals you knew of the wind of his presence without ever meeting him, because he trained so many people. And it's very similar to some of the comments that Jay made earlier about, regarding Dr. Delahaye and others, and the ability to have an impact on an environment, even when that environment has never met you or been in your presence. And so it's really an honor to be here, and thanks to Freddie. So just a little on who I am, a little on what I do, why I do it, who I do it for, and a little on why research, right? And a lot on who has helped me along this way. So I have some guiding principles as chair, and I've got two of my residents here, and also some of my adopted residents, because I gave grand rounds at the University of Maryland 2 days ago. So they also know this talk by heart already, just joking, but they know portions. And it was important to me in approaching with the faculty and the residents, and this actually came with their feedback. I mean, you go into these jobs, and you're really there for the people and for others, not for yourself. How can we continue to amplify and project who Pitt Orthopedics is and UPMC? And first, respect the past, embrace the future, which Dr. Fu and Ferguson said regularly. Residents and fellows, those of you who are in the room, even though we don't always make you feel that way, you truly are our legacy, right? It's the same way your parents probably approached you, and I try to remind myself of that with my kids. Our residents and fellows are our legacy, and education is key. But research is an essential core to the identity of Pitt, and relationships matter. Patients, colleagues, your peers, partners. For me, Pitt and UPMC, and how I navigate that for the team, and reputation will continue to rise with that. And then these are my thriving principles, because you don't just want to survive, right? Remember, things could always be worse, and that's very important in research, but very important in life. And my dad taught me that. And then relationships matter. And then from there, remember, we are in the greatest field in medicine. Now, I said this to the Maryland residents the other day. Orthopedic surgery, we actually enjoy it. There are a lot of people in medicine who do not enjoy what they do. And it's no offense to them. There are days of medicine that I don't enjoy the aspects around what we do. But I've rarely found an orthopedic surgeon for elective care, okay, throw out the trauma call, throw out the washouts, but we always come back. We're not spending most of our time trying to figure out, how do I get off the wards? How do I get off rotation? How do I get out of the ICU? And so we should cherish that. And just remember who you're in the game for. So I'll talk a little bit on mentors on my journey, and then you guys will get to see, Lee made a comment earlier about millennials, and he said he didn't want to mess with the computer because he's a millennial. So one of my senior partners called me a geriatric millennial. I was born in 1980, so technically by textbook I'm a millennial, right? But I get along with old people, as he said to me, because he's like in his late 60s. I said, well, you're not old. And he said, well, I like you, so you must be a geriatric millennial because I don't really like millennials, and I like you. And I said, well, I'm going to steal that. But I grew up in Alabama. We'll talk on that. These are my father to the left with a much stronger beard presence than myself. This was the first photo with my brother and father after the pandemic. And then to the right is my one brother who lives in Dallas with my two daughters. That was also the first time we visited them after the pandemic, if you believe in that word. So find your goal, know your goal, own your goal. And I talk about this several times in the talk. The path will come with it. So the first part of the journey for me, I grew up in Muscle Shoals, Alabama. It's a little purple circle there. Food, football, religion, music. That's what matters in the South. It actually is what matters in America in general, but in the South, very much so. And so my dad worked for Tennessee Valley Authority, and it's multiple rivers that actually core through this area. It's a major aspect of the economy, and that's where it started for me. And so the orthopedics is personal for me, and some of you know the story. I was my senior year in high school. I was a fullback, middle linebacker. You know, they put these wide shoulders to use, and I had a fracture dislocation, Weber C. Weber C fracture dislocation. It was fixed with a single screw back then. This is not my X-ray, but I had a single screw fixation, Weber C fracture. This was textbook and actually appropriate care back then. That's why Jay and others are nodding their head. I showed this to the Maryland residents the other day, and I was convinced they thought it was medical malpractice, right? They were like, oh my God, your fibula is short. You know, this is a Monday morning quarterback for the trauma surgeons every day of the week. But in 1997, this is textbook. And this actually that picture came out of the textbook of skeletal trauma when I was a resident. So, you know, single screw fixation. Jay probably did a couple of these when he was a resident on call, right? And this is my fibula now. A little short, but it healed. I was 17, little medial ankle joint arthritis, some cyst around my medial mal. I would never let anyone do a total ankle on me, not because I don't believe in them, because I'm too heavy, right? And so I know I'm going to wear it out. But at the same time, and from a sportsy standpoint, if you look at this, I've got a huge anterior loose body that I would never let anyone remove. Got a little arthritis, but I'm functioning. And so this was my first orthopedic mentor. This guy's name is Dr. A. Joyner, and this ties into OREF, which I'll talk about. So he fixed my ankle. He was on the opposing team sideline. So he was doing what orthopedic surgeons do, cover football games on Friday and call it work, right? And he enjoyed it. He was my first surgeon mentor, first orthopedic mentor. I shadowed him every summer. He wrote my letter of rec for med school and my letter of rec for residency. The same thing the students who want to follow you around now when you're a faculty member will hopefully do if they decide to pick our great field. Ironically, the relationship there was about 15, 20 years prior. My father he actually taught in school while he was in grad school. This guy was on my dad's 7th grade basketball team, right? So now I didn't know that until after he fixed my ankle. Took me to the OR, 5 days, ER casted me, took me to the OR 4 or 5 days later. He said to my dad, he's like, oh, Coach Hogan, is this your kid? I mean, he was probably in his early 30s. He'd just come back from being a Jimmy Andrews fellow, took care of him. So we'll come back to that and how it relates to relationships and research. So I went on to Xavier. It was highlighted. As Jay mentioned, you know, Georgetown, you guys are the orthopedic factory. We all know it. Xavier is a place, if you are an underrepresented minority and you want to go to med school or health sciences, this is where you go. So it was essentially a factory for life sciences and physical sciences. And so the guy to the left is a guy named J.W. Carmichael. Time Magazine has featured the program that they developed essentially in the 70s. And the president in the center there, Norman Francis. And the woman to the right, she's the president of St. Mary's College now, but I feared her. She was actually, her name is Tawanda Jordan. She was my biochemistry advisor. Everyone feared this woman. And she's smiling here, but she was pretty intense. And she would give these pop quizzes in organic. I mean, she tortured you. But she actually cared about you. And she essentially said, this is her quote, "I'm going to take you to the edge of what you think you can do and show you the door beyond your limitations." And so she was my advisor, and I was a biochem major, so I just wanted her to be happy with me so I could graduate. But she's a good friend now. But at Xavier, I did have fun. I was not this research geek. I pledged. I had a great time. New Orleans was phenomenal. Probably too much fun. But at the same time, too, I probably know more doctors from there than any other level of my life because that's what we did. You went to med school, dental school, became a PA. But it was my first exposure to research. So at the time, I was an NIH T34 Maximizing Access to Research Careers Fellow. And I'm going to talk a little bit about that terminology because it was evolved in DC. But as a MARC scholar, you had to do 10 hours of research a week. You got a stipend, so it was all about the money, but not really. But you got a stipend, you got to have a good GPA, and then you had to do 40 hours of research during the summer. So if you got selected for this program, you pretty much committed that your summertime, you were going to be in someone's lab somewhere. Interestingly enough now, because obviously, whether you think it's climate change or global warming, either way, it's a problem, right? Whether it's at the time when I was a resident, this was called the Minority Access to Research Careers Program. You say that now, somebody will probably try to bomb NIH. I probably shouldn't say that out loud, right? But the truth of the matter is the name was changed before the social justice movement. It was changed about 15 years ago because the programs in California said, we got to change the name or the NIH will not be able to send funding to the state of California. So now it's Maximizing Access to Research Careers. Whatever gets the experience flowing, you go with it. So for me, I was fortunate. So I essentially, research became a core part of my development at that time. So the first summer I spent at Purdue in their MARC-AIM program. I worked with this gentleman, Greg Hockerman, who I still email regularly in medicinal chemistry. And then the next summer, I spent the summer at Harvard working in Lori Glipsher's lab under this person, Dr. Sun-Young Pa, who is actually currently an NIH Institute director. So I still email with both of them. I think they're kind of surprised that I made it. Not really, but I stay in touch with them regularly just to say, hey, how are you doing? And thank them for being great mentors. So I then went to Howard and I met Richard Grant. And he said, you want to be an orthopedic surgeon? And I said, yes. And he said, okay, right? And the reason this is important is because, one of the things that we wrote, I was fortunate enough to be invited by Dr. Connie Chu and Bill Maloney to be a part of this, research development collaboration. And part of that conversation, it came up regularly that, hey, research in the environment matters. And I first met Dr. Maloney through Dr. Grant because they were both joint surgeons. He's the chair at Stanford. Connie Chu had been at Pitt before then. And Grant was like, oh, you should go visit Stanford. That's how I first met Bill Maloney, right? So relationships tying into research. We carried some of the same theme forward, which I'll talk about research track activity being very important in your experience and your development. And we published on that for residency programs and also the importance of research during your orthopedic training. So again, as we go back to this program, this is essentially what started research for me in my journey. So I'm going to talk about a guy named Warren K. Ash. He was at Howard. He was the vice chair of Dean of Research at Howard while I was there. He was the first African-American senior scientific director at NIH in the 60s. Now, this guy was also a little bit batty. He was a Marine, God rest his soul, and he was intense, to say the least, right? But he developed a program with the NAID, which allowed med students between their first and second year to do research at certified infectious disease or allergy research sites. So I went to IUPUI. I worked in adolescent medicine. I was a biochem major, so I selected a project studying PCRs. And so for an entire summer, I studied PCRs on sexually transmitted diseases. And my plan at that time, until I got wiser, was I was going to become an infectious disease bone doc. I was like, I want to be an orthopedic surgeon, and I like bugs. This is great, right? I was not that smart at that time. So I still take care of infections and still do washouts. But I started telling a couple of orthopedic surgeons this, and they were like, that is exactly what you do not want to become. And so with that said, but that's where it started. I was like, oh, great, I'll do ortho and I'll do bone infections. And we need more people who do a lot more of that. But this is where I met Adisu. So the summer, we had to go present our research, and he was doing his research year with Lorenzen at the time. And we were in Miami, and we were a bunch of med students who Several of us had, you guys have all done it. Several of us had a room for several days, like a hotel that is staggered. And so essentially, somewhere in the middle, it was like 5 or 6 med students from different med schools staying in the same hotel room because we had no money, extra money. You couldn't go over budget, right? And so that's how Adisu and I first met. And he was actually presenting orthopedic research. And several of us who were there were like, hey, man, we got to meet this guy. So that's how Adisu and I first met as med students 20 years ago. So I had a great experience at Howard. There were a number of icons who were there and still there. I list Alvin Crawford here, who some of you may know in the bottom left. He essentially helped develop the Ponseti bracing and the Cincinnati bracing. He was the chief at Cincinnati Children's. He spent a full month, my 4th year, he did a sabbatical during his last year as chief. So, and this is interesting. He did it so he wouldn't crowd the chief who was coming on board replacing him. And so he took a year, academic sabbatical. You say orthopedic surgeons do that. And he taught anatomy in multiple med schools for a month at a time. So he came to Howard to teach anatomy to the med students. And I was a 4th year med student who had to tour him around the whole time because Grant and Rankin and these guys and Bob Wilson, who you guys know, said, you're responsible for him. Make sure he doesn't get lost, get him back. So, and then I met Bonnie Mason. She and Dr. Grant were in practice together. And then she actually introduced me to my wife, who was fortunate enough, who still tolerates me to this day, who's a women's imager and PET CT specialist. And so I do say, few are lucky. One of the talks was speaking about relationships. You are lucky if you find a better half that fits and whatever that may be for you. Next phase of my journey was the road to and through UVA. So a lot of people here who people know. So I'm going to give a little line to this. When I went to UVA, I matched into their 6-year track. I went through 3 chairs, 2 chairs, 4 program directors, best training of my life. Now, the best part about that to the residents right now, your eyes are essentially exploding. Like your program must have been on fire. No, it wasn't. When I showed up, Shep Hurwitz, who eventually became the ABOS executive director, was the PD. Bobby Chabra at that time was the associate PD, Dr. Khanna's brother-in-law. Then from there, Dr. Lorenzen was the chair. The next year, Shep Hurwitz left to go take over the ABOS. The year after that, Dr. Lorenzen left to go become the dean of the School of Medicine at UConn. Chabra became the PD, then Carson became the associate PD, then Dacus came later to become the hand surgeon in the PD, and Mark Abel was the chair until Dr. Chabra took over. So 3 chairs, 4 program directors, and I turned out okay, right? So, and the program is thriving. So I had a great training at UVA. And Mark Miller is here. He and Carson taught me a great deal, and they were upset I didn't go into sports. And Chabra, Bobby didn't talk to me for a few weeks when I decided not to go into hand surgery. But now we're great friends. So this was my match class. So 5 of us matched there. Erica Taylor-Webb is at Duke. Keelan Miller is now at Resurgence in Atlanta. Yao Boakye-Ajay is at Duke. He's also the son of Boakye, who is essentially one of the godfathers of spine surgery. And Melissa Willenborg is doing arthroplasty in Maine in private practice. So Shep Hurwitz said to me, he said, you want to be a foot and ankle surgeon, scientist, and educator? And I said, yes. And he said, okay. He said, I'll help you. He said, be a good resident, focus. And he said, it'll work out for you. And so I applied for an OREF grant, and I gave it to Dr. Lorenzen for him to review it. My second year, I was in the lab. It was a tissue engineering project with Dr. Chabra, which I'll talk about. And he said, I reviewed your grant. I said, great. He said, you need more pictures. And I said, all right, whatever. The typical thing. Very little feedback you got as a resident back then. Also a little bit different than the expectations now. So the pictures worked. I received the OREF grant. And this tendon regeneration paper really was a springboard to my academic career from a basic and translational science standpoint. And the focus was, how do we develop a tissue engineered scaffold for Achilles tendon regeneration? That was the model. And so you listen to your mentors. He said more pictures. I put in more pictures. I got the grant. I would have hoped for a little more feedback than that because I was convinced the guy didn't read it. But he knew it was not enough pictures and not enough color to draw interest. And so I went back, revised it, and it worked out. But this was our research team at that time. Gary Bellion, who's retired, Dr. Lorenzen, and the gentleman there, Roshan James. He's in industry now. And we went on to do a number of things. So that's where bioengineering and regenerative therapies really piqued my interest. We had this rat defect model. I got to put a little bit of science in, and I've got to show at least one animal. And we developed a scaffold model with these Achilles tendon ruptures. And this was the scaffold we developed, and then we loaded it with growth factors, GDF5, and also adipose stem cells. And over the course of the OREF grant allowed me from my lab year through the next 2 years of residency to actually complete this study in collaboration with the next people in the lab. And we mobilized the rats. We published a number of papers over that time, biomaterials, tissue engineering, high impact journals. Essentially this 3D scaffold is what at the time I was fortunate because I started practice in 2013, and that year was actually the year we won the top research award for the Foot and Ankle Society. Now, again with relationships, John Gould, he's also passed away unfortunately. He's a Pitt alum. He was at UAB at that time, came through Duke, but he was a Pitt alum and he knew who I was at the AOFAS meeting because I had just signed at Pitt. And he approached me and said, hey, I heard you're going to Pittsburgh. I trained there under Ferguson. We should take a photo. I was like, okay, great. And we sent it to Dr. Fu because he loved pictures, just like Dr. Connor does. And it essentially turned up on the cover of the POJ magazine that year. It was a great start to my academic career. I went through HSS. It was a phenomenal place, great surgical training, a number of people here. And why HSS? Reputation, academic reputation, surgical exposure. But I wanted to learn clinical outcomes research a little more. Right? I was thinking, how do we translate things? I was also a resident during the advent of ACA and all the debates that were occurring there. And everyone was saying, look, we're eventually going to be looking into outcomes, quality, more than just, and I also, the big thing for basic science for me was how do we actually monitor this stuff for translation to clinical practice, to the things that we're doing. And so, and most importantly, my wife was in Philly. So when someone spoke about the decisions you make, my wife was a radiology resident at Hahnemann. She was pregnant with our first kid when I was going, and so the next year when I was a fellow, 2 years later, she was living in Philly. So I only interviewed in programs that were in the Northeast. So quite frankly, I was fortunate to go to HSS. It was far enough away where I didn't have to live with her. She didn't want me there either, right? I mean, the comments were made. She was like, hey, it's kind of worked out pretty well. You're in Charlottesville, I'm in Philly, so I don't need you to be around too much. But it'd be nice if you're closer. And so that's why I ended up going to HSS. But the unexpected. So I brought up Dr. Joyner earlier, and then we'll talk a little bit about my current experience at Pitt. So unbeknownst to me, and Lee's probably smiling because OREF knew this, I got a call from OREF saying, hey, we want to highlight your research and your grant, and we want to talk to you about Dr. Joyner. And I was like, why are you guys, how are you tracking me? How do you know about Joyner? No one really knew about this guy. And they were like, oh, you should know, his family has donated to OREF for decades. And I was just like, what? Now, and they used to run a bus business, which was acquired eventually by Greyhound, and the government took over all the bus lines for the most part in the South. And research was something he was passionate about. So this is a guy, he did a 6-year residency years ago at University of Orlando, in Orlando, and he did a year of research. So he was always, and I would talk to him about research all the time. So he was not donating his family because of me. He had been doing this before. I just didn't know about it. And they said, we would love to feature, the work you guys have done together, how you know each other. So the story comes out in 2012. And I say, hey, this guy, he saw me on the other sideline, came in, fixed my ankle 4 days later, and then that was featured in AOS Now, and he and I kind of laugh about this. Now, the reason I bring this up too is, beware of the unexpected, right? So who would have thought, and I think about this every day, never underestimate the impact you have on people and the impact that people are taking from you, patients, and that they are thinking of you. And this goes to our donation that we received, the $25 million donation. Who would have thought a North Alabama private practice orthopedic surgeon was donating money to OREF, right? It just doesn't cross your mind. And with that, it's made a difference. So my journey to and through UPMC, I met Dr. Fu in the lab, again, research. Dr. Fu drove down to Charlottesville with 2 of his research fellows. He pulls up in his A8 sedan and says, Hogan, you're the guy, Miller told me, he said, you have to tour him around. I said, I used to like meeting people and understand their story, just don't piss them off. And he said, you drive him around, and Fu pulls up, he says, you're gonna drive me around for 3 days because you know where you're going and you won't get me lost. He said, my fellows have no idea where they're going. And so he came, and you have to applaud someone who was already famous, who was doing everything possible to learn more about the ACL and to be better. And so we spent 3 days together. He said, you should think about coming to Pittsburgh. I didn't blow him off. I said, thank you, sir. I'm doing foot and ankle. I was a PGY2. I was just engaged in. And I was like, she's from Miami, I'm from Alabama. What are the chances of me going to Pittsburgh? And then several years later, my wife's brother moved to Pittsburgh. So if you ever meet her, she will tell you we took the job because of me and Fu. I will tell you we took the job because my brother-in-law lived there. So you guys get to decide which one you want to believe, right? But that's how I ended up in Pittsburgh. So the journey for me, as Dr. Denisu, as Messer mentioned, became the assistant program director essentially the day before I started. Fu called me before I started and said, I talked to Bobby, talked to your brother-in-law, and I talked to Hurwitz, and they said, you are good at educational things, you like teaching. The 2 days before I was supposed to start practice, he called me and said, you're going to be the associate program director. And I was just like, that was not part of the negotiation. But I didn't say that. I just remained silent. I said, yes, sir. I didn't ask any questions. He said, you go see the OPD on Wednesday when you start. Great. Hung up. He was like, okay, bye-bye. It was over. There was really no conversation or negotiation. It was pretty much like, okay, I just hope I'm still employed. And so I told my wife that, who was a resident, and she's like, how's that going to work? She's like, you just graduated, right? And I said, I'm not going to really do much other than, relate to, I guess, the young people in the program. I have no idea. But I became the program director at that time, true story. And in 2017, became the full PD, and then path through promotion. I did my executive MBA at CATS in 2018, and was unfortunate situation with Dr. Fu passing, but became the chair in October of 2022. So my clinical practice, I still love what I do. The orthopedic surgery part is fun, right? So the OR is still the one place, and Jay may feel the same way. No one bothers you when you're in the OR. Now, they will say if you're there too much, they're like, hey, we have an emergency, so we really need somebody to give us a response. But when someone calls you and you say you're operating, they always say, no problem, he can call me back. No problem, she can call me back. No problem, I'll check with you later. You're doing anything else, the world is there to torture you. It's just what it is, right? Even my kids will FaceTime me, and they're like, oh, daddy, we did this. And they're like, oh, I'm like, sweetie, I'm scrubbed in. Okay, bye-bye. They're done, right? But if there's anything else, they're like, oh, why can't you talk to me? But I love what I do, and my research practice is still in the basic science translational space, and more in performance assessment and healthcare delivery. So we're fortunate. We have a historical department very similar to here. This year marks our 125th year, and going into 2025, we'll be having a campaign around that, and just speaking to the history of Pitt, and similar to the 6 Super Bowl trophies, of which we hope soon we'll have 7. Fortunate to be in a sports city, but it's an old city. So a little bit on just UPMC and some of the research there, and then open up for some questions. So we're heavy, and I mentioned this because it ties into the relationship piece. Tons of hospitals, tons of employees. We have a health plan, tons of patient access. It is a very complex world. Jay and I were talking about this earlier. If you think just because you become a chair that you're just the boss, no, you just have, you have fewer people that you report to, but you have a lot of people to annoy you. But the best part about orthopedics is that, hey, everybody wants orthopedic surgery. So that is a gift that we have in our specialty. And we should take advantage of it. A policy change can happen down the street, and we could essentially become ground zero for uselessness. We never think about that, right? Somebody come up with one policy switch, all of a sudden, we're not the ones making the most money. We're not the ones generating the most revenue. We're not the ones really helping people if all of a sudden there's a complete crash. And, if one place actually blows up one of these implant companies, we'd be like, oh crap, what are we gonna do now? So I always keep that in perspective in a positive way. So a very complex system. We have, all of our docs are not employed. We have private docs, employee docs. I've left home, my North American Traveling Fellowship, and I told the Maryland residents, I left home, we had 24 hospitals. Came back a month later, we had 32. I've left another time, not a long time, but a couple months goes by, next thing you know, it's a hospital. At one point we were on pace, it was almost a hospital, and Lee is from that area. It was almost a hospital or 2 every 6 months that were joining the monster, right? And so you guys are part of a big system here too, at least with Georgetown and everyone else. So we're a complex training ground. We have 3 orthopedic residencies. We have a mothership in Pittsburgh. We have a program in A.M.A.P. We also have a program in Harrisburg. As the service line chief several years ago when I was the PD, there was one of the executives who actually asked me if I could run all 3 programs in Pittsburgh. I mean, he said that. He's like, is it possible? And I said, no. I can step out. So we can help, support, et cetera, but you can't run, it's like orthopedics wouldn't even let you do that. He obviously was not a physician, right? But that was his mindset. Like, well, why not, right? But we have more orthopedic residents who come through the UPMC system now than anywhere in the country, 85 total each year. But it's an academic clinical orthopedic, academic clinical orthopedic enterprise. I actually, coined this phrase because it truly is a COE, right? There is all the research, all the things we enjoy. It doesn't happen unless we take good care of patients, right? The interest of how can we do things better doesn't happen unless it's patient care driven. But we are a heavy environment, right? And so I love this image because I like barges and I like just looking at tankers and ports. I don't know where I got that from, but you just think about the type of, like what's in those things? Like what is actually in the tanker? What's there? But it was research that drew me to Pitt. So Fu's passion around, engineering, kinematics, growth factors. And one of the reasons that Pitt, and I thought about going back to UVA and I would have been happy there. When I got to Pitt, Johnny Hewitt was there. And he was, a great muscle-derived stem cell researcher, and I had the opportunity to work with him. We had an opportunity to continue to advance regenerative therapy and bioengineering research. Oh, that was weird. All right. So, and then the Center for Cellular and Molecular Engineering was also there. That's probably embedded in that slide from something else. Our center, Rocky Twan, was there. We now have a guy who's doing great work. A guy named Hayden Lynn and Pete Alexander are still there. We also had the opportunity to continue to just advance our biological adjunct work. I had a chance to start working with James Wong, who a lot of people don't know, but James Wong and Dr. Fu had the first R01 in the country on PRP. And Dr. Fu, I always call it the piss of platelets, but I admired this guy. He would go to a meeting and he essentially would say, oh, the latest is not the greatest. And then you would go back home and you would see his research team essentially researching every single element of that. You're like, this guy didn't like it. Why is he researching? He was always chill. He never said respect the past and stay the same. But he would definitely torture you if you were using things you didn't understand. So don't use the piss of platelets. That's bad. So we were fortunate enough in 2020, again, from our tendon work, we won the Golden Award again with AOFES. We now have translated this work into a clinical trial with the DOD to use metformin as a topical for Achilles tendonitis. So it's a lot of translation there. I use this case because this is an example of a 28-year-old. I had a syndesmotic injury. This is a guy I did a consult on. He had a distal fibrillar fracture. They missed his syndesmosis. By the time they found that he was still having pain weeks later, he had full thickness chondral loss, kissing lesions. They tried to go back and fix him, to try to stabilize the syndesmosis. Didn't happen. He essentially had a frank synostosis, never played again. Luckily for him, he played 4+ years in the NFL and was able to get a pension. If it had been 3 years, he would have gotten nothing, right? So, but again, nobody's gonna be sorry for orthopedic surgeons or NFL players. So, but the fixation debate goes on. And so I've been very fortunate by being at Pitt also, being able to work with Volker Musal and Rich Jepsky with their robotic work. And so we developed a full knee through heel model, the proximal tib fib through the distal tib fib to assess syndesmotic injuries. We got a AOFES grant for that. And then our early robotic research we published, and then also looking at fixation options. They really break in athletes and people who are super active. Screws don't really break in people who are not that active, so that's why you can leave them in. If they do break, they do fine. I've been working with Bill Anhurst in our dynamics lab, and then essentially with this, started looking more and more at foot and ankle pathology since we started there, which has been great. But we still have more questions than answers. If you look at syndesmotic injuries, we took a number of patients I took care of, small cohort, but we ran them through the kinematic lab. And when you look at what we do for fixation, screws, suspensory fixation, hybrid, none of it actually restores normal kinematics at all, right? And these are the things that we're always constantly trying to study. How can we be better? But even when patients do well, even when they have good outcomes, it doesn't necessarily restore them to their normal side. So what's worse, that they don't have normal kinematics or that they're actually doing well despite what you did to them, right? So again, still more answers than questions, still more questions than answers. A little bit of just my outcomes experience. So Judy Baumhauer was a great mentor. I met her first. Richard Grant connected us. She said, if you want to do foot and ankle, you got to meet Judy. So he connected us on the Gmail when I was literally a resident. I had no idea who she was. I was just happy that she would speak to me because she was an icon already in the Foot and Ankle Society. And she really helped guide me on developing our patient-reported outcomes platform along with some of the HSS mentors. We talk about costs. We published on cost value of orthopedic, foot and ankle platform for performance. And I'm really interested in this overall. And so everyone was getting outcomes. We built our tablet program at UPMC initially. Jay Air Gang helped with this. We then, established our outcomes platform for all of our subspecialties. And then I was constantly talking with Shep Hurwitz about all these things happening with healthcare, about CMS. And I said, what do you think is going to happen? All these BPCI programs, all these different things. And Shep was the executive director. He said to me, Matt, we cannot be the specialist where our answer is always no. Our answer is always don't call me back, don't annoy me. He said, it's not sustainable. And he was right. If you think about it in healthcare, most people were asking for certain things. They came to the doctors first in most cases. Everybody's like, where these HCAPs come from? CMS came to physicians 30 years ago and said, hey, how can we actually start looking at outcomes? What do you think most docs said? Go kick dirt. Go kick dirt. We've got this. It's probably like 15, 20 years ago. So what did they do? Oh, great. We'll get a couple of docs, a couple of analysts, and we'll come up with an analytical model around HCAPs. And we'll run it on old people, and then we'll make you apply it to everybody. I mean, that's what they did. And so the more we're at the table, again, that's what the importance of advocacy and research. So be careful what you ask for, write about. I wrote this study about resident fellow education and how do you learn how to operate. Freddie forwarded to the whole system, unbeknownst to me. This is our chief quality officer. She called me the next day after he sent it and said, I really would like you to join our committee on OR efficiency. And I think you could really, provide us some mature, conversations. I was a second year in practice. And I said, why would you get mature conversations from the second year in practice? You know what that actually means? They were talking to probably more senior docs who didn't want to talk to them. Right? I knew that trick. And so I went to FAOA and said, is it okay for me to go there? So that's what you should do. If somebody random emails you from administration, she's a nurse, you always go ask your chair, hey, is this person legit? Or is this a setup? Right? And FAOA was like, oh, she's great, go work with her. The next year, the CMS bundle launched, and that's how I got involved in this type of work. There is no escape, right? So healthcare won't destroy us, but if we just run from it or have tunnel vision, it's not a good look for us. So a positive attitude gives you power over your circumstance. So I was like, hey, this actually could be fun. There you go, HCAPs, complication rates, patient-reported outcomes. Everything about this is a money equation. Don't let anyone fool you. It is essentially a financial model, right? The government does not have enough money to pay for the care that we need to provide. And they want to provide high quality care. So until we figure out how to help with that equation, this will continue to go on until the end of time. So we developed a comprehensive joint replacement model with a number of joint surgeons. It was not just me, but I was a perfect neutral position person because I'm not trying to steal their joint cases, and they know I still operate. So I'm a good partner in theory. But we developed a number of dashboards. All of our surgeon dashboards they have access to. When I went to these first meetings, outcomes was actually not even filled in. It was all these other metrics that I thought were insignificant. Over time, we filled them in with more things the docs wanted. We also now have clinical dashboards for joints. We have some for spine, foot and ankle, obviously the bias, where we have outcomes and a number of quality metrics that we actually feed to the docs. We compare it across facilities. It is not a perfect science, but it's very important. And you want to be the captain of your own narrative when you can be. And also it had financial targets associated with it. So for us, it's been a great physician partnership. Information is accessible to everyone. It's been a key part of my journey because I actually enjoy looking at data from a scientific standpoint. And we leverage it across the entire organization. Private docs are not bad people just because they're not in academics. They actually keep the lights on. And everybody in orthopedics is essentially, you're doing work, right? It's different than the model of White Tower model where I do 2 cases and I sit here all day and someone else is doing 200 cases to pay for me sitting there. In our model, the orthopedic surgeons across the board are working. Now, some of us may be giving more talks and things like this, but when we're there, we're hustling. And that's how FAOA wanted it, and that's how I've always liked it. So, but we don't weaponize data against one another. And this is something that orthopedic surgeons need to evolve with, right? Attorneys don't weaponize against each other when they're talking to non-attorneys. Docs, by our nature, just by quality review, M&M, we live to torture one another. And that's okay. I mean, it's okay if it's going to groom toward progress. But if you're just weaponizing just to try to make yourself look good or someone else look bad, it doesn't help us as a profession. So it's been a good financial impact for this. It's helped us invest academically, clinical programs, our research programs. We launched our fellowships, academic productivity, and reinvestment for our navigators, joint replacement program. Again, we did the seed money for our fellowship with this. A number of optimization programs. This is essentially why we can actually buy robots each time, and we use them. We don't buy them and just put them in the corner and like the Da Vinci people, right? So it's very important for us to, know what you're doing, and it's all driven by data. So we've launched a Center of Excellence program with our health plan. This is giving great exposure to UPMC, our department, at a number of spaces. And it also, in my environment, has actually really helped because essentially our health plan now has a quality program that they have launched, and that's a revenue generating and patient care delivery space. So Lorenzo taught me a number of things. Listen to your mentors again. He said, Mac, problems that go away by themselves come back by themselves, and usually when it's least convenient. So do what you can to try to take care of the things that are difficult early, right? And I'm still guilty of this. I'm not the perfect person for this. I'll let things hang. How do you deal with them? So it's an evolution. But your environment matters. So again, research environment is key. This is how we've developed our Bethel Musculoskeletal Research Center. That's Dr. June Lee, who's one of our professors of spine. He operated on Oil and Bethel Spine. Took care of him. The guy donated $1,000 2 years in a row. No one knew he was actually the third largest egg producer in the country, and he lived right outside of Pittsburgh. He then came and endowed a share of $2 million, as Dr. Connor mentioned, several years later. And June and I would talk about, we both were Howard Hughes research fellows in undergrad. He went to Berkeley, I went to Xavier, right? So research kind of, united us. And we said, well, yeah, you can do something like that, but you got to have somebody who's going to help fund it. And fortunately for us, Mr. Bethel just donated $25 million to our institution, which will allow us to develop a Musculoskeletal Research Institute. The dean matched that with another $25 million. And so we're very excited about what the Bethel will do. So we have a great team at Pitt. It's a number of groups. But again, find your goal, know your goal, own your goal, the path will come. But remember, just theory things, remember it's not about you, right? Everybody brings self-interest. That's actually a good thing because you have opinions, you have perspectives, you have something to contribute. But it can never be purely about you, right? I always say this about island. No one really wants to be on an island by themselves, right? Even the billionaires who have an island, they have a runway with a jet and a helicopter so they can get off from time to time, right? So or a boat, whatever your choice may be if you're filthy rich, right? But so you got to know that. But you have to be about it, right? Be about your patients, be about things that are passionate for you. I am a big Robert Frost fan. As I said, I took the road one less traveled by, and that made all the difference. And so when I was a resident, no one had gone to foot and ankle at UVA for 25 years. And so Shep, when Hurwitz was there, it was great. And now a number of people have gone into the field, still not enough. And so Miller and a number of people would mess with me and say, oh, you're going to hate your life because you can just do toe ulcers all day. And I was like, oh, and I would say to them, why are you so angry? And so, but I've been fortunate with that. So some of you have heard this, there's a vacuum of opportunity in healthcare, enjoy that, right? Everything is happening in healthcare. Be a Dyson, don't be a cheap person in healthcare though. I mean, you don't have to be super expensive, but don't sell yourself out and be cheap. So engage, listen, discuss, plan together, maybe best apart, but better together. And all of these people here, I mean, you talk about AI in healthcare, right? Like CVS, and all these things are happening, and some are in, some are out. What are we going to do the first time an AI algorithm? When I was in Maryland, I said, what are we going to do the first time that algorithm says you shouldn't operate on this person? And the next time you have to do a peer review, you're talking to an AI-generated person who already knows how to tell the person from Georgetown, from this address, no 7 times in time for them to give up and not try to do it, and therefore we save $50,000 on our spine case. That's what AI can do. It can say, you know what, they're calling from this place. We know that if we say no 6 times over 7 days, they will actually cancel the case. I mean, some of the stuff is actually mind-boggling that it can do. So we have to be engaged with it. Saying, because I know our health plan is trying to do that stuff, and I will listen to some of this authorization stuff, and I'm like, wow, right? So you do need to advocate for your patients, and we need to lobby. But the question is rarely what, it's usually how. So life is short. There's a moment to really take advantage of it and follow your passion that's now. I'm a Colin Powell fan, so perpetual optimism is a force multiplier. So it's really hard for me just to be actually not optimistic in some way. But life is like golf. Keep your head down, focus on the ball, and the crowd will tell you where it's going. So the verdict is out on my effectiveness, but the verdict is, I'm very excited. When people say, are you enjoying your job? I'm like, look, I enjoy waking up every day, coming into the madness. So to me, I love it. My wife looks at me, she's like, I don't know how you do this. And she's a physician. She's like, you roll over 435, you kind of limp into the bathroom, and then you're gone, right? And I'm like, what? It's perfect. As long as I get my coffee and my 2 shots of espresso, I can make the day happen. All right. So, but be not afraid, be courageous. I mean, and Freddie was, and I wear the food pin. I said, what better to do? I've come to DC. So I have the food pin, my PIP pin, my BMRC Institute pin, and my OREF grant recipient pin, which Lee was very keen to pick up earlier. So, but be courageous in what you do. And remember, those in the crowd that matter the most. So I've had a lot of great mentors. They're not all on the slide. A lot of great allyship, all the buzzwords, a lot of great leadership. And the best part about these individuals is that they've told me the mistakes they've made. And that was one of the best parts of food. Like, he would call you from time to time, particularly when I was PD, he would say my whole name. So those of you who didn't know him, I'll speak about, he was, Hong Kong, thick Chinese accent. So he lived in single syllables. Yes, no, no, no again. So for me, he would call me Mac. And every once in a while, he would call me and say Hogan. But and then he'd call me like MaCalus, I have made this mistake before. And so Chinese guy, Hong Kong, thick accent, says 3 syllables and says your name, you listen, right? And he would say, MaCalus, I've made this mistake before. The best part though, he was telling you, you can do it, go for it. He said, but I'm telling you, I've fought this particular fight before. And you would learn with that. I think that's what we have to do. We have to be willing to hear not only the successes, but the challenges people have. So again, this is my wife and my kids. They keep growing. My daughters are into everything, sorcery, as well as, horses, and both, junior black belts in Taekwondo. And they've evolved. If you didn't notice, my wife went to the University of Miami. And this is when my kids were much smaller. And that bottom right picture with the mask, that was the first day we went out together during COVID, during the shutdown. And we look at this picture all the time because they were the happiest they could be, because my wife and I are both home. They were like, you're home. We don't know when you're going back in. We're safe. We're healthy. Our grandparents are good. They were loving it, right? And so you want to spend time with your family. And so to that, again, I want to thank Jay. I'm an all-in girl dad, and my residents know this. And we used to do grand rounds on Saturdays. I changed that when I became chair. I think it gave me popularity with the residents. But the only drawback to it, and my residents are here to witness it because we used to do it Saturday morning. So now we do it on Wednesdays. But the only drawback is I would bring my kids in the grand rounds. And, it's nothing like when your kid's on the iPad, not paying attention, and they see an x-ray of a hand up. And like, Daddy, that's a hand. And they say it really loud. You're like, shut up. You can't talk. But that said, it's just more time, but now we go to games together. And to that end, I did last night, I called Jay at DC, and this was completely off of me and my wife's family schedule. And it was this sneaker ball with my kids that I had no idea about. I thought it was next week. My wife thought my admin knew it was this week. Complete chaos. And I was supposed to be here for dinner last night, but I want to thank your chair, Dr. Khan, for understanding, and Lee and the team, because they did say to me, they're like, oh, I went to Maryland on Thursday to give grand rounds. I'm like, you'll be back for the ball, right? And I was just like, what ball? So I was and so, but again, family matters, and it was great. So as Fu would say, thank you, thank you, thank you. And it's an honor and privilege to be here and continue to do great things. Thank you.
Thanks so much. No, it's great. Really, really, really. Thank you very much. Thanks for doing this for us. Thanks for the inspirational story. Yeah, and then I'll give you awards. But any questions from anybody? You guys, you have no idea how invaluable this type of advice is, to see somebody's pathway. And as you all know, good judgment comes from experience. Experience comes from bad judgment. We've all made a lot of mistakes. Dr. Fu probably saved you from making more than you need to. But from the residents, any questions about careers in academics, balancing work life, as we heard about earlier today from Dr. Hogan before we announce the winners? Or anybody else? Dr. Sterling, any thoughts?
Great advice. Actually, I have a question, Dr. Hogan. I mean, you're a young guy.
Yeah.
And you were the young guy when I was a fellow at Penn, and obviously Dr. Fu admired you. But and obviously we're here, except Burroughs is younger than me. And so as young people, sometimes you see people who are older, and you're like, if I get in a position of power or influence, like, how do I deal with this old guy
Yeah.
who's 20 years old, don't do like that?
Yeah.
So how do you deal with that in your practice? I know you got guys like Bradley who are 100 years
Oh,
old.
yeah. No, and I was, lots of dinners and, dinners at locations they like. No, I'm just joking, but that's part of it. So when you mentioned Bradley, I literally had dinner with him Wednesday night. No, I can't remember which night it was. I think it was Thursday night after I got back from Maryland. I had dinner there with him and our chief of trauma and our executive vice president of the hospitals just to talk about stuff, right? And I did get asked that question a lot when I was going through the chair interview process. And then, so a couple of things. I am a stern believer of you do have to attempt to meet people where they are. And you can't erase the value and experience of time. And that is a hard thing. And for me, I've got a brother who's 10 years older than me. So he was like a brother / father figure. Like he really never listened to me. Like why would he, right? And he's 10 years older than me. He's like successful on his own. But being able to have conversations outside your comfort zone, but having conversations where you can help. We use the word disarm, but disarming someone makes it seem like, okay, I'm going to disarm you to then stab you. No, that's not really it. Just so that you both can have a level of cordial conversation. So I enjoy work. If you haven't noticed, I'm a people person, but I can actually go completely mute on people too and just kind of observe. And so you have to be willing to listen to people. And one of the things that I took one of the slides out, listening to someone to respond to them is totally different than listening to them to understand. And it's sometimes when you're in a rush, it's hard to have that. And so Fu was rapid, but you hear a lot of people talk about him historically. You had all these people who would mention, hey, there's this time where I just felt like I was the center point of his focus. And as a fellow, it's hard to see that because you just saw this guy just, back, forth. And then you realize, those moments where people were like, what is it? It's just like a whirlwind. I felt like that too. So you definitely have to understand where they're coming from. And so I'll give you another example. When we did the joints bundle work, I went to every single hospital where there was actually, and we talked about a little bit earlier, like you go to a couple of different places. You're running around. Fu said, are you okay traveling? I said, yeah, one place per day. And so I went to every hospital, all 8, and I then went to every practice. Somebody went with me. I would take someone else. Every practice where they were doing high volume joint replacement, I went to every one of them. Now, there were a few of those practices where there were definitely more state dinners and long conversations than some of the others. But then word got out, like, hey, this guy will come talk to us, and then you show up with a little bit of data, the weaponizing point, right? You're not here just to criticize them. And so when Jim calls me now, he'll say, Mac, the system needs to allow us to help them make money and take care of people. And you're like, okay, Jim, what happened? Right? I'm like, Jim, what happened? He's like, well, nothing really happened, but I was like, no, tell me. Like, I want to understand what happened, And so that's what I would say do. But you also have to recognize, and look, I'm an optimist, but I'm a realist too. You're not always going to be directly aligned with everyone. And for me, I'm okay with everyone in the room not agreeing on everything. Because I think I do believe that is where you get to the edge of being better. But you have to be able to move forward. So I can function with somebody who actually doesn't agree with what I'm suggesting. Like if you knew June, you saw him at a distance. He and I disagree on a lot of stuff, but we are in agreement on we have to keep moving forward. So we'll say, I don't really like that. He'll say, oh, that's a good idea, and vice versa. How do we keep moving forward? Versus the person who wants to be an anchor. You know what anchors get? Left at the bottom of the ocean, right? And it's just, so I may not be the one to clip them, but somebody will. Or, and that's what you just don't want to be an anchor. So you want to try to find a space where, and as you're working with other people, how can you help them not be an anchor or, you not be an anchor to them? And that's one thing I'll give Freddie. When I visited Stanford, this is a long response to your question. Mark Safran said something to me when I was in early practice. He said, people who were not successful in food space, it was usually their own fault. No matter whether they agreed with him, disagreed with him, he said, because he gave an environment for opportunity. So it was very difficult to just be unsuccessful there unless you actually were an anchor. You just couldn't move, right? Because he put you in. I mean, the guy called me a day before, like, you're gonna be the associate program manager. I'm like, what the hell is this guy thinking? Like, this is gonna be a disaster. Worked out. So, but yeah, I would think about it like that. But great question. Happy to get, yes, sir.
So actually do that. There's a lot to a relatively short career still, so kind of mid-career surgeon. How do you decide what to say no to?
Yeah. So I'm still working on that, and I make tons of mistakes, right? As indicated by the fact I didn't catch my daughter's head a ball. I was supposed to be here the day before. So a couple of things. One, and they talk about this in business school, but it's really just talking about things in life, right? It's not a business school peril, but the concept that if you say no to something, the opportunity will never come back again. You have a lot of that. And well, okay, well, if they ask me now and I say no, does that mean they're never going to ask me for again, right? It's not like dating where you're like, they ask me out, I say, this is my one window. And that's a balance. And then the next thing I've tried to work on is, okay, what are the things that I'm uniquely qualified to contribute to? Like uniquely contribute to. Certain things you're uniquely qualified to contribute to them because of your knowledge, experience, or status, right? There are just some things they're just always going to say, you know what, we need the chair to chime in on this, period. Like, we're not going to move unless the chair says A, and but there are other things where you try to empower people around you is one thing I've tried to do to say, hey, I'm not saying no to you, but I am going to suggest this person to help with that. Now, and this is when I did learn in business school. So my advisor in business school said, Mac, if there was a period when I did my program, it was 18, 19 months. The year before, I obviously was not thinking about how committed, I knew it was going to be hard work, but people were still calling to go give talks and stuff. And I was like, oh yeah, sure, I'll figure it out. Because I'm thinking I'm going to do the typical thing, fly in, a couple hours, fly out, in, boom. And she said to me when the program started, she's like, you're supposed to be in China for a week in the middle of like statistics. She's like, how's that going to work? And I was like, I have no idea. I'm just going to do it on the plane, et cetera. And she said, okay, but she said something to me. She said, as you move forward, if someone asks you to do something, and she said, you should say to yourself, if this was next week, would I do it? And she said, if you have pause, you either need to figure out a way to say no appropriately or recommend somebody else for it. And that has been helping me a lot, right? And then she also said, never commit to anything at once when it's asked. She said that. She said, don't do it. She said, when people call you, you say, great, let me review my schedule, get back to you, because that is definitely a business world concept, whereas we're conditioned, we're conditioned like cattle, right? You get paged, answer your pager, call back, got a constant NDD, I'll be down in a second. It's almost inherent in us to say yes, to take care of people. So it's a balance. And then also saying no to a few things that you're just miserable doing also helps. When you're like, why did I agree to do this? And you want to be committed, but you're like, why did I agree to do this? How do I get out of it? I don't want to be, but being able to respectfully step away is reasonable. There were a couple of committees I was on when food passed and I was, potentially in consideration for the chair, they called and asked. And I just said, look, I don't know what the world's going to look like in a year. I said, so respectfully, I would like to decline from this. But that was one of the first times in my career that I had done that, where I just said no. And I can tell you, it comes back. North American Traveling Fellowship, I applied, didn't get it. Then the next time it came, I was like, oh, I'm not going to do this. Next time it came around, I didn't apply. And they said, we want you to apply. Then I didn't apply the third time. They called back again and said, well, and I said, why are you not applying? And I said, look, I've got my wife's here. I've got 2 small kids. Like, this is probably not a good look. She might not be here if I go on this trip for a month. And then they call my mentors. That's where it gets harder. When your mentors start calling you and they start saying, hey, you should do this. And those are the ones I think about a little more even now. And in that scenario, I called Cato, I called Bobby, I called Chef Hurwitz. And all 3 of them said, they said, the best time for you to do something like this is while your kids are so small that they won't forget that you were gone that long. And by the time it got around to my wife, who was really the ultimate decision maker, she actually said to me, because she trusted my mentor, she said, well, what'd they tell you to do? And I said, well, they think I should do it. But I said, but I won't do it. I was like, I won't do it if you're going to be gone as soon as I fly back home. And I was very direct. Like, and at the end of the day, it worked out, right? And so we hope that it continues to work out. But that's a great question. I appreciate it.
Awesome.
Good.
And the winners.
All right. So should we announce it together?
Do we have have the photographer?
Okay.
No, he left.
Oh, he left, okay.
Oh, he left.
All right, so this is the time.
Because we want, yeah, we want pictures
But you
of
should be
him
in someone when you go shake hands.
You go and take the
Oh,
picture, not as good as you.
with
We'll
Lee.
have a, oh, okay. So we did that, well, with him.
Yeah, I guess.
Okay.
Yeah. So somebody,
I'll take the picture.
That's the third. Brian, actually, I wouldn't mind it. Can you come on down and have somebody else take them?
Oh, yeah, I see what you're saying, so you got.
Yeah.
he
MaCalus.
has,
Ryan, what you got? We'll figure
This is like a wedding invitation. You're like one of the people getting married. You gotta be in the photo.
Those two guys?
and the residents of.
Okay, we got 10 minutes before this turns off.
Okay. All right. So the third place, we have a few third place winners, but the first third place winner is Matthew Weber. Come on down. Congratulations.
Photo, yeah.
Okay, let's do this.
Fantastic.
Great. Okay, so the next third place winner is William Jones from the Rothman.
Here, here. This is for 2024 with no one being a fifth or fourth place winner, right?
William, you need to see Carmen in order to get your money.
Now he's gonna go.
So the last third place winner is Matt Olivar. University of Maryland.
University of Maryland. And soon to be Pitt Sports.
Oh, yeah, I didn't know.
Yes.
That's your
I'll tell you.
Yeah, exactly.
Okay, great.
Okay, so the second place winner is Denver Kraft.
From Georgetown?
Congratulations.
Congratulations.
Okay, great. And the other second place winner is Alex Gu from George Washington.
You want to do the presenter's voice?
The presenter's choice.
Lovely.
Thank you.
Okay. So the presenter's choice is Michael Rad from Johns Hopkins University.
Great one.
Hey, congratulations.
Okay. Drum roll. Yes, drum roll. So first place winner is Brian Shear from University of Maryland. Congratulations.
Hey, congratulations.
Could we get one photo of all the winners?
One come down.
But you can just do it by themselves.
Excuse me?
You want to do it by themselves?
Yeah.
Yeah.
All of you together, sounds great. I think the photo.
Okay, we're not getting this.
Should we not read in there?
Lee, you should be in
Why
this.
don't you go in the
It should be an OREF theme, so you get in the middle, get in the middle, Lee. Yeah, that's enough. Yeah. No. We should move this out.
Congratulations.
Thanks everyone for being here on behalf of MedStar, Georgetown Ortho, and the OREF. Thanks to Lee Grossman and team, Carmen, Deborah, everybody else for honoring us with allowing us to host this and supporting it all financially and otherwise. Really, really appreciate it. Thanks for helping to jumpstart our research program. Thanks to all of the leadership from GW, Hopkins, who's not here, Howard, and what other program am I forgetting about? Maryland, of course, and all the other programs. Thanks to Dr. Hogan for giving up 2 days for us and inspiring us, leading us, training so many of our residents in your fellowships. Really look forward to everything and wishing you all the best in your careers in orthopedic surgery and consider academics. And sorry to starve you all. Please grab a lunch on the way out and have a great Saturday. Enjoy the rest of the weekend and your Mother's Day, especially for the mothers in the audience.